Happy Wednesday. It is one of our favorite days of the week. It is Wednesday, and we're going to be talking about myasthenia gravis. This topic is necessary, especially if you get a case study and you are asked, very important, you are asked, what is the difference between myasthenia gravis and multiple sclerosis? Oh, you got to know these two, very important. Hello, if it's your first time joining me, my name is Professor Regina, and I am the leader of Remar Nurses. So happy to be here as your NCLEX instructor on this Winning Wednesday. And the topic that we are working from, these are the two books in the program, okay? You have these two. Glory, I got the... If you know, you know. It comes from Myasthenia Gravis, comes from Quick Facts for NCLEX, y'all. All right, so we're going to be working from Quick Facts for NCLEX. I have some great notes to share in addition to the things that are already in there. We like to call this Winning Wednesday because we have nurses who have successfully passed their NCLEX just recently, and they want to tell you how they are winning. Well, I have one tonight for you, and I am so happy to see her. Say hello.
Hi, everyone. Hi.
Now, your story is so amazing, and I'm so glad that you came on here to tell everyone how you got the big letters behind your name. So tell us who you are, where you're from, what you did.
Hello, everyone. My name is Kalista Wachuku. I am an international nurse. I'm from Nigeria.
Yeah. Mm-hmm.
I passed my NCLEX last week.
Amazing.
After listening to the last topic, because my exam was around 2 p.m., I listened to cholesterol. I was just in the house. Yeah, I was just in the house. Tension was just coming. Anxiety was just trying to set in. I said, no, I'm going to bridge it. I had to log in. And also, I just listened. After that, the last testimony we had, I congratulated the lady. Then I left for my NCLEX.
Oh.
Yeah. So when I got in there, they did the usual rituals. Then I sat down. They gave me my paper as usual. The normal routine. I will. I have already passed my NCLEX.
Yes.
I wrote it down. Oh yeah.
Isn't that great?
I wrote it down. So I started with my questions. So the first question that came was
okay, well, you can't tell us the question. Don't tell us what it was.
I know.
Okay.
I know. The question was next gen NCLEX. Sorry, question. Yeah,
okay.
that was what I had. Almost. In fact, just to summarize everything, my computer showed at 85 questions.
No.
85. I said, oh my God, I hope I've not failed again. But within me, I had another second thought that, Kalista, you did well. Because all the questions that were just coming were just like similar to what I had in my question bank when I was just doing my revisions. So I had about 85 questions. If I would say like 40 or 35 questions were next gen NCLEX, just like the episode. That's what I just almost,
Wow.
So I really, in fact, within me, just like as a human being, I knew that I did well. But at 85, I just pray because I have felt like 3 times.
Okay. I was gonna ask, was this your first time taking the NCLEX? I was gonna ask
that. The 4th time. Fourth.
What turned it around for you? What do you think? What did you do differently? What did you do differently?
This 4th time, I really focused on your instructions, the content. My quick fact. Although I have 2 quick facts, one is the regular one is the next gen. I have 2. So I was really, the first and second and third one, I didn't read as I read now. So I read this quick fact, the new one, like 3 times.
That's good.
I read it like 3 times. 3 times. Then my workbook almost, in fact, I can't even give it to someone. My work, it was just full.
That's the content.
I was writing with pencil.
Yeah.
So you can see that's my workbook. So
Wow.
I really did a good job because the first and second one, the first one I used ATI, I failed. Second one, they said Kaplan is just the best. And when I ran to Kaplan, I did not do well. Then the third one, I took Rema, but I did not really focus very well on content. Like this one, I make sure I read almost all the disease conditions, everything in quick fast. If I would say like, so one lady said that she was just reading just like a Bible. I was reading like a Bible. My husband said, "Sweetie, can't you just rest?" I said, "No, that's my second Bible, guy. I have to read it. I have to read it this time." So I was just reading it. At work, what I would do, I would use my phone, put in my earbud. I would just be listening to. Yeah, that was what I did. I just went an extra mile this time around.
That's it.
Yeah. Mm-hmm. So after listening and over and over and over and over again. So when I got to when I went to my test center, Regina, the questions I was answering in question bank were difficult. They were difficult to what I saw in NCLEX.
Sorry.
So, I tell you, so just like your questions really brushed me up because I thought I'm going to do something that is more difficult than what I had in question bank. So this really helped a lot.
Ooh,
guys,
so
I will advise you, please, just go to this. Don't joke with this. They are very, very vital, very extremely vital, so they really helped.
So what did you do if you saw something on the NCLEX that you weren't familiar with? What did you do if you didn't recognize it right away?
I was going with my first thoughts.
Okay.
That's what I was doing. So by the time I would read the first line to the last, I had about 2 questions that I didn't know what I'm supposed to do. But my mind told me, Calista, pick this. I read down and read down and read down and went with my first opinion. So
good. Very good. Okay. All right. Awesome. So what kind of nurse are you going to be? What is the next thing for you?
I want to be a pediatric nurse.
Oh, good. Great. We need pediatric nurses. I could never do it, but I want you to go in there and be amazing, representing Nigeria in the house.
Yeah.
So proud of you. I'm so proud of you for not giving up and for actually doing the work, because you can wish all you want to. You can wish that you want your license. You can wish, but if you don't put in the work, then you won't get the results. So you planted the seed and now you're eating the fruit. So congratulations. Yeah.
Please, guys, don't just joke with the 2 books, please. I mean it, please. This time around, as I studied, I got it.
Got it.
Please, I just want you guys just to follow my footsteps. You will make it. You will make it. Yeah.
Okay.
Yeah.
Wow. A beautiful testimony.
Thank you so much, Pastor Mark. Thank you. Thank you, good family. Thank you. I'm so grateful.
Thank you so much. God bless
for those that have not passed, please have faith. You will make it.
That's right. That's right. We are proud of you. God bless you. Bye-bye.
Bye.
Remar nurses are amazing. Coming back on Wednesday is because they know where to find us. They know where we're going to be studying, and that's the coolest part, because we are here every Wednesday night, 9 p.m. Eastern Standard Time. Welcome to class. Let's get into our topic for today. And like I said, it's myasthenia gravis. You must know this one. Okay, you got to know this one because these patients need a lot of help and their condition is specialized. So you have to understand the anatomy of what's happening. Lord, please be with me right now. I got to pray, y'all. I got to pray my voice through this. You have to understand the anatomy of the myasthenia gravis to understand the diagnostic test, to understand the treatment. Okay. And it's very closely resembling multiple sclerosis, but not the same. Not the same. So myasthenia gravis, if you remember, this is an autoimmune disease. So this is a disease where the immune system is mistakenly attacking its own tissues. And so what happens is this, the hallmark of myasthenia gravis is that you have progressive muscle weakness. And this muscle weakness, can somebody put the page that you have for quick facts? Because whenever I say my page, it's not the same as your page. So can you put myasthenia gravis, the page that you have? So what happens is that the patient gets progressively weaker with activity because they just don't have the receptors. 56, it's the same. Okay, they just don't have the receptors that are able to make the connection between the nervous system and the muscular system. All right, the muscular skeletal system. So you will be asked questions about what is going on. What is the underlying cause of myasthenia gravis? And it is going to be that the body is making antibodies to attack its own self. And that's something that we should never expect. Okay. We should never expect the body to make its own antibodies. What do we call antibodies that attack their host body? What do we call those? You might remember that from, well, I guess it'll be pathophysiology. What do we call those antibodies that attack their host? We call them, and you guys be taking notes on this on page 56 if you have this, be taking my notes. We call those auto antibodies, okay? Auto is self. So we call these auto antibodies. And what these auto antibodies are doing is they are attacking what? What is the big misfunction? Okay, what is the big misfunction or dysfunction in the body that those auto antibodies are attacking? It starts with an A. Yes, this is all about acetylcholine. Acetylcholine, and acetylcholine is a communicator. So it communicates from the nerves to the muscles saying, hey, we need movement here. We need movement. But when the body is attacking acetylcholine, yep, there you go, Susan. When the body is attacking that acetylcholine, then there is no communication. And so the patient is not strong. They are actually quite weak. So let me read my notes to you here. So this happens when those nerve signals don't properly reach the muscles. They don't have the acetylcholine communicator. Okay. And so this occurs because the connection between the nerves and muscles is called the neuromuscular junction gets disrupted. All right. And so as a result, the muscles don't signal to move properly. Yes. And this gets worse. It destroys those acetylcholine receptors. Absolutely. Great comments today. Okay. Great comments today. So the signs and symptoms, what we're going to see here, and this is different. Let me go back. Okay. This is very different from multiple sclerosis because you're going to have weakness in multiple sclerosis, just like you're having weakness here in myasthenia gravis. But let's talk about the difference really quickly. The difference is with multiple sclerosis, what is being attacked there? Because it's also an autoimmune, right? What is being attacked? Not acetylcholine, not the neuromuscular junction. What's being attacked is the brain and the spinal cord. All right. So very different already. Okay. You're going to be looking in different places. Yes, that myelin sheath. That's what's going to be the issue for multiple sclerosis. So what we're going to see in myasthenia gravis, and try to stay with me here, we're going to have the inability to operate your muscles, ones that you like to control naturally. So weakness of the eyes. So like blinking, okay? Patient's eyes will droop down and the patient won't be able to open them. All right, those muscles in the eyes are not going to be as strong. Drooping of one or both eyelids. Blurred or double vision. I have here in quick facts, these are the ones I have. difficulty talking, difficulty chewing, weak eye muscles, visual disturbances, and unsteady gait. Unsteady gait, all because of a disruption of the acetylcholine. Okay, go back here. All right, difficulty swallowing, shortness of breath, of course, is the issue that we want to avoid in these patients. We want them to get treatment right away. Patient have impaired speech and just a generalized weakness in the arms, hands, fingers, legs, and neck. All right, how are we going to diagnose this? Well, 3 important points that you want to know for diagnosis: physical and neurological examination. So we're going to physically look at the patient. We're going to measure out their muscle strength, tone, how are those muscles coordinating? Is there an appropriate sense of touch? And particularly looking at the eye and the eye movement. You won't see that as much focused on when it comes to NCLEX with multiple sclerosis. So if you're looking at somebody with generalized weakness and the NCLEX is focusing you on their eyes, their eyelids, where you could be thinking, I saw somebody put it, is this a stroke? Is this Bell's palsy? Or is this myasthenia gravis? Okay. And if you can even do that, you are phenomenal. If you could even look and think of 3 differential diagnoses, you know your content. So the next step will be to do an adrophium test. Okay. Now, this is a name that I put here for a reason. All right. This is a name that I put here for a reason, because you might not see this word. You might see the Tinzelin test, right? And I have the Tinzelin test in Quick Facts. All right. But I wanted to go deeper into exactly what that was. So you're going to get the adrophium, and it is used to test muscle weakness. So what they do is they inject this into the body, and what they're seeing is if the patient gets stronger. Okay. Because this particular test is going to help, I have here, help block acetylcholinesterase. And if we're talking about acetylcholinesterase, that is what is breaking down acetylcholine. So if your body is having more acetylcholine, your muscles can get stronger. You will have a positive Tinzelin test. And then the doctor will know, okay, well, this is not multiple sclerosis. This is not a stroke. This is not Bell's palsy, because we see that the response is related to acetylcholine. And because it's acetylcholine, we know this is myasthenia gravis. And so what happens is, like I said, the patient gets stronger. How many people knew that? Okay. The Tinzelin test allows the patient to pop open those eyelids, like bam, eyelids open. Okay. Patient strong. Okay. Now, this is a good indication of myasthenia gravis. You knew that. All right. Now, tell me, how long will they be strong for? If you studied the Tinzelin test, and this is what I'm talking about, breadcrumbs and Quick Facts. Quick Facts is going to guide you. All right. But if there is something that you read in here, you're like, oh, yes, okay, it's making sense to me. Sit with it for a minute. You should probably read this book 3 or 4 times. 3 or 4 times. 56, page 56. So Tinzelin test, the thing about the Tinzelin test is that it is short-lived. I mean, very short. Okay. Like, patient going to be strong for about 5 minutes. And then after that, what's going to happen? They're going to revert back to themselves. All right. And that's why this is so phenomenal. And it's such a good test, because immediately the patient will like, I'm regular. And then as the indrophobum, as that goes away, then it's like, all right, patient returns 5 minutes, 5-10 minutes. All right. So the whole goal of you coming to class is always learning something new and reinforcing what you do know. So put that in your notes. Okay. Blood test also, again, we might see elevated levels of the acetylcholine because the receptors are trying to get a signal through. They are trying to get a signal through. So we are looking for those as a diagnostic criterion. Shout out to Nurse Richard, says, good night, everyone. I passed my NCLEX on the third attempt, July 2nd. I am so grateful to you, Regina and Mark. God bless you both. I will continue to pray for your ministry. Thank you so much. Thank you so much. And congratulations to you. Thank you for coming back, letting us know. Okay, so yes, there are other ways to diagnose this for sure, especially if you're trying to rule out other conditions. So we are going to continue on. All right, let's talk about the treatment. Cholinesterase inhibitors. Okay, so that makes sense because we want to slow down that breakdown of acetylcholine at the neuromuscular junction. So they have here pyridostigmine and then neostigmine as medications that you should actually be very aware of. You should, when you see them, know exactly what they do. Okay, the names may be a little weird, but put these on your refrigerator, put these on the mirror in the bathroom so that you immediately can identify what is going on with your patient when you see them on the NCLEX exam. Immunosuppressive drugs just make sense. Immunosuppressive drugs make sense because this is an autoimmune disorder. It's an autoimmune disorder. So by suppressing those autoantibodies, your patient will do better. And there are many medications that will suppress the immune system. Also, the complement inhibitor. So if you can have a part of the immune system that you target specifically, and this will do the same thing. Another treatment that I have in quick facts that you want to know is plasmapheresis. Okay. Plasmapheresis is a thing for myasthenia gravis. Do not come out of the exam, okay, without the knowledge of plasmapheresis. Okay. So many testimonials. I'm going to try to get to them all. Kiki says, hi, Regina. I passed my NCLEX September 12th on my second attempt. God is good. I thank you for all your work you've put and dedicated to Remar. You are doing the Lord's work. Indeed, indeed, indeed. And so were you in nursing. So were you in nursing, because it is a ministry. Okay. Nursing responsibilities. I got questions coming up. I got NCLEX questions coming up. So get ready to tap in. You know, when we get to the responsibilities, we are winding down the content. Yes, there are many ways. You could do this plasmapheresis, because I see this here. Plasmapheresis. You can take out the thymus, and it's not even directly related to acetylcholine, but some doctors may recommend that the thymus is taken out. Not everybody, though. Not everybody. So it can work in some patients. Comment noted. All right. Okay, nursing responsibilities, monitor vital signs, respiratory status, and the ability to cough. Why is that important? Because that is a muscle that you should control. And it's also a reflex that you should have. Okay. Coughing and deep breathing adequately, looking for respiratory failure, because that is a very significant part if your patient has myasthenic crisis. And then monitoring suctioning and having emergency equipment at the bedside. Please pay attention to the clinical priorities in quick facts for myasthenia gravis. Those clinical priorities are going to be very important on your NCLEX. I can't write out questions in quick facts. I can only write out answers. So please interpret everything that is in the clinical priorities as a possible answer. Okay. All right. Don't forget quick facts for nursing school. I'm seeing it on TikTok a lot. It has myasthenia gravis in it as a subtopic, but also many, many more. So if you need med surg and pharmacology help, then the quick facts for nursing school can be added to the V2 to help support you. V2 is my lectures plus the books plus the question bank. Okay. All right. Here's time for NCLEX questions. I'm going to put my book away. And we are going to get into it. Here's question number 1. I'm looking for 3 of 3 today. Okay. One of the medications used to treat myasthenia gravis are immunosuppressive drugs such as, come on with it, let's warm up, 1 prednisone, 2 cephalosporins, 3 aminoglycosides, or 4 antivirals. Roll it on in, roll it on in. Okay. Amazing. As I expected. Everybody get this one right. Okay. Everybody get this one right. Correct answer is going to be number 1. Number 1. Very good. So immunosuppressive drugs are going to help improve motor strength because those auto or abnormal antibodies will be decreasing. Great job, everyone. Moving on. I'm moving on. How about this one? A patient with myasthenia gravis is admitted with severe respiratory distress and reports increased muscle weakness after starting antibiotic therapy with streptomycin. What is the nurse's priority intervention? Number 1, increase the dose of the patient's pyridostigmine. 2, hold the next dose of streptomycin and notify the doctor. 3, administer supplemental oxygen via nasal cannula. 4, prepare the patient for non-invasive ventilation. What answer will you go with? Oh, this is a good one. This is what I love about Winning Wednesday is that we get to do the content, which is important, but then we get to actually apply it immediately after with our questions and see where you shake out. Okay, see where you shake out. And we're always looking to shake on the side of safety. So either you're a safe nurse or you're not a safe nurse. You are a safe nurse if you picked number 2. Number 2, this is the priority here. All of them are good. But we know from the stem, where do I tell you, look at the stem. We know that this issue started after what? After streptomycin. Okay. If you have quick facts, you already knew this. This would be an issue for the patient. So streptomycin, no bueno. Okay. And it will make patients with myasthenia gravis worse because it helps to further break down that thing I told you about. Okay. The thing that's not high in patients with myasthenia gravis. If you know it, put it in the comments. All right. Good job if you picked number 2. None of the other ones are the priority. And not that they're not right. They're right. Okay. These things are good. They're not bad. But just with NCLEX, you have to directly see that answer in the stem. They have to go together. Okay. All right, let's go. Question number 3 says this: a patient with myasthenia gravis develops sudden severe weakness, difficulty speaking, and labored breathing. The patient has been compliant with medications. What should the nurse do first? Number 1, check the patient's medication administration record. 2, administer intravenous immunoglobulin. 3, prepare for intubation. 4, administer additional pyridostigmine as prescribed. What are we gonna do? Oh, you're a new nurse. You never had a patient with myasthenia gravis before. NCLEX put these 4 options in front of you. All you got to do is keep your head in the game and go for safety. That's it. Go in there, think safety, anywhere from 85 to 150 times, and walk out with your license. That's the goal. Okay. What you're doing today, I'm telling you, is going to be helpful when you go into that exam. Because my questions are hard. These are not easy questions. That's why people don't come here a lot, because they say she's doing so much. I'm doing just enough to get you to pass. Okay. Correct answer is number 3. It's number 3. How many people got this one right? Number 3 is the safe answer for this patient. My goodness, why? Because if we look at the stem, it tells me everything I need to know. My patient with an autoimmune, weakening muscular issue develops even worse symptoms than they normally have. Okay. So they have a sudden, severe weakness. They're already weak. And then they have difficulty speaking. Well, okay, that means the muscles are not working. And then the breathing is labored. This sounds like myasthenia crisis. But am I wrong? I don't know. Let me keep going. The patient has been compliant with medications. What should the nurse do first? I got to save my patient's life because they're having severe respiratory depression, severe respiratory weakness. Okay. All right. So be so careful, because number one means you leave that patient and say, wait, let me go. I got to go read the chart and see what nurse Henrietta gave you this morning. Okay. Not going to be safe. Okay. 2 is great, right? It's a good treatment. However, your patient is having severe respiratory weakness. Got to do something. Get this patient ready for intubation. They need it. All right. How'd you do tonight? How did you do on tonight? So good. Prepare for intubation. That was the correct answer. And I would say that you should be feeling more confident when it comes to myasthenia gravis after tonight's study session. So if you came and you feel better and you feel more confident in this subject matter, then that's a win. That is the goal. And it only took you 30 minutes. And we listened to a testimonial for like 8 of those 30 minutes. So we did a 20-minute study session, and this is something that you will not forget, okay? As long as you are going back and reviewing it. So like I said, quick facts is to be read 3 times, okay? At least read it, reread it, write in it, go back over it, okay? Did y'all hear on the video that I did? This is quick transition why I have your attention. Because I was going to go live about this, but I just don't know if I'm going to be able to. So I talked about it on TikTok and Instagram, if you saw those videos, about taking NCLEX at home. So I just wanted to discuss that with you for a little bit before I got off this live. But I recently found out that they being NCBSN, they're preparing to do the NCLEX at home. So that is something that will be in the very near future, like probably after next year. Do you have anything for nursing school interest? I have the T's. I have the T's book, Quick Facts for T's. Okay, you can go there. So yeah, so I'm really excited about this because, as I was saying, back in 2019, at the height of the pandemic, nursing students were saying, hey, can we just take this exam at home? And the NCBSN was like, no, absolutely not. Like, we're not into that. We're not doing that. No. We have testing centers. Even though the testing centers were closed down, people's NCLEX dates were canceled minutes before, hours before, and then they went to reschedule it. And it was like, okay, we can't reschedule you for another 6 weeks or whatever. So at the conference last week, they revealed to us that they are indeed putting plans in place to be able to offer an at-home NCLEX starting as early as 2026. So that's next year. I mean, it's 2025 already, right? It's 2025. And so in my mind, I'm like, how crazy can this thing get? Because, if you're taking NCLEX at home, maybe it might be good, maybe it might be bad. I don't know. Can you manage your test anxiety better at home? Or is it better to go to a place that is new to take this exam? I don't know. It's like, if I'm home, are my kids home too? Are people coming in and out distracting me? Do I have to lock the door? People who have computers, what type of computer do you have to have? I mean, there's so many things. I don't know. I'm seeing like people would like that. It'd be more relaxed at home. Right. So essentially what this does is that it opens NCLEX up to even the whole world, right? And certainly for us in the United States, we know that there is a time capital, there is a certain amount of effort that is required to get to a testing center, right? You have to get up, you have to drive, you're nervous the whole drive. You have to make sure you get there on time. So you're like leaving 3 hours early so you're not stuck in traffic. And so being able to take the NCLEX at home will eliminate that. It will eliminate. Y'all need to share this video because a lot of people don't even know that this is possible. And it makes so much sense when you think about it because there are already other exams that are offering remote proctoring. And so this is a thing that is totally possible. And I absolutely see the reason for it, right? Because during COVID, NCLEX became irrelevant. Okay. NCLEX became like we have a health crisis going on. We don't have time for nursing students to try to figure out, this licensure process that they're not prepared for in terms of the actual board because they couldn't get the testing centers open. So people were working without a license. Y'all know that. So NCLEX is a business and they have to respond to the demands of the consumers. So get flexible. Yes. Oh, absolutely. If you are taking it at home, you will absolutely be proctored. You will be in front of a camera. Actually, you won't be able to take it if you don't have a camera. There's just some things you must be able to do. Okay. You must be able to do. So I do believe that they will have both options in the beginning. I don't know what'll happen after that, but sure. There's so many testing center locations. I know that they're not going to close those centers down in the next year or so. So you probably will have the option to do both. You can do it at home or you can go to a testing center. Like I said, if you're not subscribed, if you're not following this channel, you need to be, because every time I get new news, then I will be sharing it with the Remar nurses because I want us to be informed and I want us to be able to reduce some of our anxiety because we already know what's in front of us. All right. So I hope, what are the comments? It seems like a lot of you are actually leaning in towards this and you're flexible. Okay. And I think that's great. That's great. Yeah. ATI proctored exams at home. True. Yeah. People already have the technology. And as much as we are investing into the testing process and the licensure process, they should be able to do anything. They should be able to accommodate any of it. They probably could buy you a computer and be like, just take it and then send this back in. So that is Winning Wednesday for today. It's always a pleasure to be here with you. I hope our time is always seen as something that's valuable and we are one step in front of the other, making progress. If you are in Kenya, I will be leaving my home country, the United States, to be visiting you in just a few days. So I will be spending pretty much the entire month of October in Kenya. The only time I won't be there is when I am in the plane traveling there. So 2 days there and I will be there with you guys. So thank you so much for welcoming me back to your country. And I will still keep my Mondays and Wednesdays, even though I think it'll be Tuesdays and Thursdays there. We'll still meet up. Okay. We'll still meet up and we will do our study sessions. So God bless you all. Have a good evening. As always, I love to say it because it's so true. You can, you will, and you must pass NCLEX. Good night, everybody.